My plan for health care costs a lot of money. It costs $740 billion. It doesn't cost $30 trillion. $3.4 trillion a year, it turns out, is twice what the entire federal budget is. That's before it exists now, without interest on the debt. How are we going to pay for it? I want to hear tonight how that's happened.
How do we pay for it? We pay for it. Those at the very top, the richest individuals and the biggest corporations, are going to pay more. And middle-class families are going to pay less. That's how this is going to work. What families have to deal with is cost. Total cost. That's what they have to deal with. And understand, families are paying for their health care today. Families pay every time an insurance company says, sorry, you can't see that specialist. Every time an insurance company says, sorry, that doctor is out of network. Sorry, we are not covering that prescription. Families are paying every time they don't get a prescription filled because they can't pay for it. They don't have a lump checked out because they can't afford the copay. What we're talking about here is what's going to happen in families' pockets, what's going to happen in their budgets. And the answer is, on Medicare for All, costs are going to go up for wealthier individuals and costs are going to go up for giant corporations. But for hardworking families across this country, costs are going to go down, and that's how it should work.
I, who wrote the damn bill, if I may say so, intend to eliminate all out-of-pocket expenses, all deductibles, all co-payments. Nobody in America will pay more than $200 a year for prescription drugs because we're going to stand up to the greed and corruption and price fixing of the pharmaceutical industry. We need a healthcare system that guarantees healthcare to all people, as every other major country does, not a system which provides $100 billion a year in profit for the drug companies and the insurance companies.
My health care plan does significantly cut the cost of it. The largest out-of-pocket payment you'll pay is $1,000. You'll be able to get into anyone who can't afford it gets automatically enrolled in the Medicare type option we have, et cetera. But guess what? Of the 160 million people who like their health care now, they can keep it. If they don't like it, they can leave, number one. Number two, the fact of the matter is we're in a situation where, if you notice, he hadn't answered the question. This is about candor, honesty, big ideas. Well, let's have a big idea. The tax of 2% that the senator's talking about, that raises about $3 billion. Guess what? That leaves you about $28 billion short. The senator said before it's going to cost you in your pay. There will be a deductible in your paycheck. You're going to, the middle class person, someone making 60 grand with 3 kids, they're going to end up paying $5,000 more. They're going to end up paying 4% more on their income tax. That's a reality.
Let us be clear, Joe. In the United States of America, we are spending twice as much per capita on health care as the Canadians or any other major country on earth.
This is America.
Yeah, but Americans don't want to pay twice as much as other countries.